Hello everyone, welcome back to my channel Prosto Hub, and today we are going to discuss the second part of our topic Aesthetics in Complete Denture. So in our previous session we have discussed the fundamentals of aesthetics and the various factors influencing the appearance of dentures, and we were discussing the various steps in achieving aesthetics. I think we have discussed till teeth selection, and in this session we will be discussing the remaining portion as well as the Dentogenic Concept and Dynesthetic outline, which is the most important part of this topic. So you can expect Dentogenic concept as a separate short note. You can expect it as a chairside viva questions, the SPF factors. It is a very important topic which you should never miss for your exam preparation. So to those who are new here, my name is Dr. Jolsna, and through this channel Prosto Hub, I discuss some of the important prosthodontic topics which you may find useful for your MDS University exams. And if you have any queries or feedbacks, you can either comment below this video or you can mail me at this mail ID. Now, before beginning the topic, I would like to remind you about the Prime membership program, which we have discussed in the previous segment. You will get the benefits like early access to new videos and quick reply for your comments, queries, and also free access to the PowerPoint presentations. So if you wish to join the Prime membership program, you can click the link given in the description box below the video, and thus you can subscribe to it. So let's begin the topic. So in the last segment, we have discussed the steps in achieving aesthetics in complete denture, the first three stages, that is the importance of accurate impression, the jaw relation, the importance of vertical dimension, and also teeth selection in providing aesthetics. And next, we have to discuss about the arrangement of teeth as well as denture characterization. So, the two main objectives in dental aesthetics are to create teeth of pleasing inherent proportions and of pleasing proportions to one another, and to create a pleasing tooth arrangement in harmony with the surrounding tissue, that's the gingiva, lips and face of the patient. So while doing teeth arrangement, our goal should be to have the front teeth look aesthetically pleasing, and also it should allow the patient to speak clearly and have all the teeth positioned for the best comfort, stability and retention of the dentures. So the arrangement of teeth is a very important and crucial aesthetic factor, and the arch form, profile of the patient and smile line of the patient are the guides for initial placement of the anterior teeth. So we know that the arch form and arrangement of anterior teeth should be proportional to the arch form of the residual ridge, and also the inclination of the maxillary and mandibular teeth should be parallel to the profile of the patient's face, as you can see in the picture. You can give a slight inclination, labial inclination for the maxillary teeth, otherwise it should be parallel to the patient's face, patient's profile, and then the teeth must be arranged in harmony with the smile line of the patient. So the incisal edges of the maxillary teeth should follow the lower lip line, and we have to avoid the reverse curve. And as you can see in this picture, the teeth should rise along the occlusal plane towards the back in order to follow a smile line and also give an impression of the distance. So you can see here it is following a smile line. And the level of the occlusal plane, if it is set too low or if the anterior teeth are set on a flat plane, then the teeth will be too much visible, and so if the patient smiles, the teeth will not follow the smile line of the lip. So the orientation of occlusal plane also have an influence, and if it is not parallel to the interpupillary line, then the smile will look crooked. And we know that the dental midline should coincide with the facial midline. So these are the points which you should remember while setting up your anterior teeth. That is, the dental midline should coincide with the facial midline. The occlusal plane orientation is important. The inclination of the maxillary and mandibular should be parallel to the patient's profile, and the smile line, it should follow the incisal edges, it should follow the lower lip line. So these points have to be kept in mind while setting up your anterior teeth. And also the modification of teeth arrangement can be used to create illusions. So this is the second most frequently used technique, which involves changing the position and arrangement of teeth to create illusion of decreased or increased width or length. So if a tooth is rotated distally, it will have a thinner appearance, as you can see in this picture, whereas if it is rotated mesially like this, it will look much more wider. So, as Morton has stated, the key to aesthetics lies in asymmetry, slight modification in the position of incisors such as overlapping, rotation and small diastema and incisal variation, which may change the light reflection, just enough to produce artistic distal composition which is desirable for the patient. So we have discussed in detail about these narrowing and widening and shortening illusions, that is by changing the tooth contour and tooth color in our smile designing PPT. So if you wish to know in detail about these, you can go and refer to that section. Finally, coming to denture characterization. So characterization of complete denture is necessary for the denture for a lifelike appearance. And we have already discussed about the benefits of a properly contoured denture base and also the indications of an aesthetic complete denture in our previous session. So as per GPT, denture characterization is the modification of the form and color of the denture base and teeth to produce a more lifelike appearance, and it includes festooning, stippling, replicating alveolar eminence in flamed or bulbous gingiva, tinting of the denture base, and incorporating imprints of rugae in the denture. So we know that normally the gingival margin has got a scalloped or festooned appearance, specifically around the cervical areas of the teeth, and we can replicate it during the wax up stage by properly contouring and shaping the wax. And also the vascular appearance can be simulated by placing vertical fibers on the buccal and labial surface. And again, stippling, which is a orange peel appearance that is seen in the attached gingiva, which is due to the microscopic elevations and depressions of the connective tissue. And stippling, it can be replicated by different techniques, that is toothbrush technique, offset burr technique, blow wax technique, and can be done with the help of a sponge. And then replicating alveolar eminence, that is a series of swellings which is corresponding to the roots of the teeth, and it is most marked in the anteriorly situated canine eminence, and that can also be done by contouring the wax. And these prominences, they become progressively less marked in the premolar and molar regions. And then inflamed or bulbous gingiva, similarly it can also be reproduced by leaving more interdental wax. And then the tinting of the denture base, where we use different shades of heat cure or autopolymerizing resins which are painted onto the denture base or are painted onto the mold during denture construction to obtain a tinted denture. And then incorporating imprints of rugae, where the patient can regain the maximum sensation of contours in the palatal area. So there are different techniques for that also, which the most common one is by luting a dental floss, the thickness of 0.75 mm, with inlay casting wax in the trial denture base prior to flasking. So these are the different techniques of denture characterization. As such, denture characterization is an important topic. You can expect a short note from this. If you want denture characterization as a separate short note video, please do comment below this video. Next, coming to the dentogenic concept, the most important segment. As I've already said, this is a very important topic. You can expect it as a separate short note or even as a chairside viva question. So the dentogenic concept was introduced by John Fresh and Roland Fisher in the year 1955. And the word dentogenic, it is similar to the word photogenic. So dento, that conveys in reference to the prosthetic dentistry. So basically dentogenic is the art, practice and technique used to achieve the aesthetic goal in dentistry, and according to Fresh and Fisher, it is the gender, personality and age which can be used as guidelines for tooth selection, tooth arrangement and denture characterization, which is to enhance the natural appearance of the individual. So the factors of dentogenic concept include sex, personality and age, that is the SPA factors. And the success of dentogenic concept coincided with great advances in denture materials. And also one thing is that the use of these guidelines is only valid if the edentulous patients want their appearance similar to their previous natural teeth. Coming to the SPA factors, the first one, the sex. So we know that the form or shape of the teeth differs in males and females, and in case of female, softness is the primary aesthetic characteristic. The roundness, softness and smoothness are for typically women, whereas in men they show boldness, hardness or aggressiveness. So the differences in the shape of anterior teeth in case of males and females are: in females, the incisal angles are more rounded and the teeth have got a lesser angulation, whereas in males the incisal angles are rounded to a lesser degree and they have a teeth more angular. And coming to the incisal edges of central incisor, it's parallel to the lips, and the laterals are just above the occlusal plane in case of males, whereas in case of females, incisal edges of both centrals and lateral incisors follow the curve of lower lip. Then, in case of female patient, the lateral incisor should be rotated to show its mesial surface a little bit, which helps in softening the smile, whereas in male patient, lateral incisor should be rotated to show its distal surface a bit more, which helps in hardening the smile. And also in males, the mesial end of the lateral is hidden by the central, so this makes the canine very prominent, whereas in females only the mesial third of the canine is visible because they are rotated anteriorly. In males, up to middle two-thirds of the canine should be visible. And also the cervical region, they are also prominent in case of males. And females, usually on smiling, exposes more anterior teeth. Hence, the premolars also should be arranged based on aesthetics. So these are some of the differences that you have to keep in mind while arranging the anterior teeth in case of males and females. Second factor is the personality. So there are mainly three divisions of personality: the delicate one, the medium pleasing, that is the normal one, and the vigorous, which is the hard and aggressive one. So the dentist should select and arrange the teeth so that it improves the patient's personality. And one more thing is that the more the dentist knows about the patient, better dentogenic restoration he will be able to provide with him in relation to his personality. So usually we select more squarish, larger teeth for vigorous people. And in case of executive people, their anteriors, they should be relatively smaller and more symmetrically arranged in a flat plane. And the maxillary canine arrangement also differs according to personality. In case of an aggressive patient, you can go for a pointed long fangy cusp, whereas in case of a delicate soft personality, you can go for a blunt rounded short cusp form. Coming to the third factor, that is the age of the patient, which is very important in teeth selection because of the physiological and functional changes that occur in the oral tissues. Now we know that as the patient ages, the mandibular teeth become more visible, and also there can be phenomena happening like attrition, abrasion, migration, gingival recession, etc. So to replicate attrition, we can simply grind off the incisal edges, whereas selecting a longer tooth, contouring the wax and positioning the tooth properly can reproduce recession. And also usually teeth set with lighter shades are commonly used for patients of younger age group, whereas slightly dark colored teeth are set for patients belonging to older age group. When considering teeth arrangement, especially anteriors, we select teeth with an unworn incisal edge, well-defined incisal embrasure, low chroma and high value for younger teeth, whereas in old age group we select a shorter, whereas minimal incisal embrasure and also teeth with high chroma and low value. Next, coming to the Dynesthetic interpretation of the dentogenic concept. So, in the previous slide, we have discussed about the dentogenic concept, which is the prosthodontic appearance interpretation of three vital factors which every patient possesses, that is a sex, personality, and age. Now, Dynesthetics can be called as a secondary factor of a dentogenic restoration. It is a compounded word. The prefix dyne, it is actually coming from the Greek word dynamics. So, uh, to construct a dentogenic restoration effectively, along with the SPA factors, there should be a detailed consideration of three equally important parts of denture, that is the tooth, its position, and the matrix, that is the denture base. So if the dentist and the technician properly treat the tooth, its position, and the matrix correctly, a pleasing personality can be revealed, masculinity and femininity are effectively created, and the age of the patient is dignified in the smile. So, Dynesthetic techniques are the rules which concern three important divisions of denture fabrication, that is the tooth, its position, and the matrix. And the application of Dynesthetic techniques to dentogenic concept help us to bring psychologic as well as physiologic comfort to the patient. So, a dentogenic restoration is fabricated within the framework of Dynesthetic procedures. Next, let us see the Dynesthetic considerations which are necessary for the production of a dentogenic restoration. So there are 15. First one is the mold, the lip support, midline, labioversion, speaking line, smiling line, position of incisors and canines, spacing between the teeth, the embrasures, buccal corridor, the long axis of the teeth, the gum line, the interdental papilla, the lingual cutaway, and the labial and buccal denture base contours. So we will be discussing one by one in detail. Coming to the first consideration, that is the mold. So selection of an acceptable personality mold involves its subsequent treatment for attrition, abrasion, erosion, depth grinding, shaping, polishing, etc. So here you can see in the first picture, we have reproduced attrition by grinding of the incisal edges, and here we have reproduced erosion, and the third one, the depth perception. So depth perception is actually limited in the artificial tooth because the contact point is too near to the labial surface. So here you can see it is too near to the labial surface. So here depth perception has been increased by depth grinding, that is a cut made on the labial mesial line angle of the artificial tooth. And also the personality mold selection. We know that a delicate mold is feminine and a vigorous mold is masculine. So a medium pleasing personality mold is made more masculine by squaring of the incisal edges, whereas it is made more feminine by simply rounding of the incisal edges, which we have already discussed in our previous slides. Next one is the lip support. So a pleasing lip support is usually achieved by anterior teeth and their matrix. So in order to get or support an upper lip in a natural and a pleasing manner, we do bodily anterior posterior positioning of the teeth, especially the central incisor. So in this picture you can see the position A is for maximum mechanical stability, whereas the position B, C and D, they represents the progressive dynesthetic positioning of the central incisor for pleasing lip support. Next is the midline, which we have already discussed that the facial and the dental midlines should coincide. But usually the features of a face slant one way or another, and it is rather difficult to see a true midline in a dentition. It is usually more eccentric than is noticed. Therefore, an eccentric midline in a denture, if not too exaggerated, is acceptable and may give the illusion of a natural dentition. And the mid-axis of the central incisors should be vertical to the incisal and occlusal plane. So here in the first picture, it is an acceptable midline even though it is not coinciding with the facial midline. Whereas in the picture B, the mid-axis of the central incisor is not vertical to incisal and occlusal plane. So this is not acceptable. It gives a much anesthetic appearance. Next one is labioversion, which is a deviation of an anterior tooth towards the lip from the normal line of occlusion. So usually the upper central incisor approximately 30° inclined to the line perpendicular to the occlusal plane, and labioversion is necessary because the most pleasing effect is obtained when the long axis of central incisor are either vertical or with a slight labial inclination. We have already discussed this in anterior teeth arrangement, and this labioversion is determined by observing the teeth in profile when the patient is in a standing normal posture. Next is the speaking line, which is the incisal length or vertical composition of the anterior teeth. So when the patient is speaking seriously, one should evaluate the tip of the lateral incisor. And this is the guide to the vertical composition using incisal edge of central incisor in their relationship to the lip line at rest. Here you can see that for a young man and woman, it is 2 to 3 mm below the lip line, whereas in middle age and old age, it decreases. So, according to this guide, the tip of the incisor should vary in different degrees according to the sex and age requirements. Next one is the smiling line, which should not be confused with the speaking line. So here smiling line is an imaginary line along the incisal edges of the maxillary anterior teeth, which should mimic the curvature of the superior border of the lower lip while smiling. We have already discussed about the different types of smile lines, the Jan classification in our smile design PPT. So this is a curve which follows the incisal edges of the central incisor up and back to the incisal edges of lateral incisor and then to the tips of the canines. and the arc of the smile line is determined by the age of the patient and it decreases as the patient gets older. So in the figure A, the sharp curve of the smiling line gives a youthful appearance, whereas in figure B, the broader curve indicates an older dental composition. And also the curvature of the incisal line is more pronounced for women than for men. A curve means that suggests softness. So grinding of the incisal line to create the curve expresses femininity. Next, coming to the position of incisors and canines. So according to Steen, upper anterior teeth are like fingerprints. They are no two alike. They vary from one individual to another, and this variability manifests itself in size, color, form, contour, and surface markings. So coming to the central incisors, which are the cornerstones of tooth position. So if the position of central incisor is correct, then the position of all other teeth will be more nearly correct. And the placement of central incisor controls the midline, the speaking line, the lip support, labioversion, and the smiling line composition. And also the central incisor are the basis of personality mold selection. And their importance actually lies in their primary forward positioning in the mouth, and they are the first teeth to be seen during the smile. And their shape is controlled by physical personality of the patient, and their positioning determines the strength and action of the dentogenic composition. And also the relationship of central incisor to each other is also important. One central incisor is always placed broadly ahead or behind of the other, as you can see in this picture. And from there we give different degrees of rotation, labial inclination, axial divergence, which produces effects of additional strength, activity, and vigor to the entire dental composition. And the central incisor should contrast sharply in size with the lateral incisor. So the degree of contrast is actually based on the experience and interpretation of the dentist. And usually we select a smaller size lateral incisor, and the canine is usually in the same mold size as that of the central incisor. And also the central incisor must be depth ground, which we have already discussed in the previous slide. So here, as you can see in this picture, the first one, there is a dynesthetic positioning of one cervical end in, whereas one cervical end is out. Whereas in the second picture, there is bodily forward positioning of one central incisor. And in the third one, this is an extremely active and strong position where there is a combination, that is one cervical end in, one cervical end out, and then there is a bodily forward positioning of one central incisor, and also there is a rotation of the distal surface forward on their axis. So the positioning of the central incisor actually depends upon the personality. Next, the position of the lateral incisor, which is subordinated in importance to that of the central incisor. However, its rotation will either harden or soften the dental composition. As you can see in this picture, the soft position of lateral incisor is produced by rotating its mesial surface outward, whereas the rotation of the mesial surface inward produces the hard position of lateral incisor. And also, the right and left lateral incisors should have a symmetric long axis. The lateral incisor should be positioned so that at least a portion is seen when the patient speaks seriously. That is a speaking line determination. And the lateral incisor also expresses sex characteristic. The sex determination comes from either rounding the incisal edges for feminine effect or from squaring the incisal edges for masculine effect. Coming to the canine, so the position of the canine or the cuspid tooth in the arch form is important because it supports the anterior arch form in its widest part and also controls the size of the buccal corridor. And the canine should be carefully positioned so as to dominate the lateral incisor and to complete the desired upward curve of the smile line. Now, the cuspid should be abraded to convey the physiologic age of the patient in the dental composition. As you can see here, it is abraded in a curve as in figure A, B, C and D, whereas E illustrates an unnatural and improper flat abrasion. Now, there are three basic requirements for the canine teeth position. The first one is that the tooth should be rotated to show its mesial surface. And then it is the cervical end that should be outward. It's not the tip, it is a cervical end. And finally, when you observe from the side, the long axis of the canine should be vertical, as you can see in this picture. The next consideration is spacing between teeth. So spacing between anterior or posterior teeth can be extremely effective, but their size and position must be artistically and hygienically designed, or else they will become sites for deposition of food, plaque, calculus, etc. So there are certain rules that should be observed with the spaces follow. The first one is that all spaces must be V-shaped to shed the food. So you can see here these spaces are V-shaped. So this is the proper self-cleansing form of the diastema. And then a diastema between the central incisor is unsightly and it should be avoided. Diastema should be asymmetrically placed on either side of the dental arch. For example, if a diastema occurs between the lateral and central incisor on the right side, then it should not be repeated between the lateral and central on the left side of the arch. Then the width of the diastema, it should be controlled so as not to appear unsightly at any instance. So if the diastemas are too wide, they appear as black holes, whereas if it is too narrow, it is difficult to make so as to shed the food. Therefore, if an extremely narrow diastema is desired, then an embrasure should be used instead. Similarly, spaces are placed between the posterior teeth for the additional spillways for food through these spaces, and also it creates additional cutting edges formed from the marginal ridges. And grinding the proximal surfaces of the posterior teeth can sharpen these cutting edges of the marginal ridges. Coming to embrasures, so you should not confuse between embrasure and diastema. Diastema means there is proximal separation of teeth, whereas embrasure represents a divergence of the proximal surface of the anterior teeth from the contact point. As you can see in this picture, so E represents the embrasure, which adds sense of freedom to the appearance of the dental composition. And an embrasure is employed in the same manner as that of a diastema or spaces, but much more frequently. Next is the buccal corridor, which is also called as a negative space, which is the space created between the buccal surfaces of posterior teeth and the corner of the lips when the patient smiles. So the buccal corridor gives depth to the smile, and it begins at the canine, and its size and shape are actually controlled by the position and slant of the canine, even though the actual buccal corridor exists posterior to the canine tooth. Now, the size of the buccal corridor is not critical, and the appearance of the buccal corridor is actually influenced by various factors which we have already discussed in our smile designing PPT. Now, the use of the buccal corridor, it prevents the 60 tooth smile or the molar to molar smile, which is often characteristic of the denture. So that you can see in this picture. This is a molar to molar smile and it is giving an anesthetic appearance. Now, the inclusion of buccal corridor in dentogenics accomplishes an added illustration of reality. So this is the one which provides depth to the smile. One, the long axis, which is a two-dimensional imaginary line which passes through the cusp or the middle point of the crown and the apex or middle point of the root. Now, upon close examination of position of natural teeth, it can be noticed that their long axis vary. We have already said the lateral incisor, the long axis should be asymmetric on either side. And even though this variation is sometimes in minute degree, it is there. And so it should be exaggerated in the dentogenic restoration as an artistic device. And the variable long axis of the teeth become accentuated with age. Coming to the gum lines, so these gum lines are at the cervical ends of the teeth and they should vary in height, and there are certain acceptable rules for the placement of the gum lines. So they are, it should be slightly below the high lip line at the central incisors, and it should be lower than the central incisor gum line at the lateral incisor. That means the lateral incisor should be lower than that of the central incisor gum line and higher than the central or lateral incisor gum line at the canines, and it should be slightly lower than at the canine at the bicuspid and variable for bicuspids and molars. So these are the general rules. Next is the interdental papilla, which is the main part of the tooth matrix or the visible denture base. So the interdental papilla occupies 1/3 of the total importance of the dental composition, whereas the remaining 2/3 are occupied by the tooth and tooth position. So we know that there are three important aspects of denture fabrication, that is a tooth position and denture base matrix, of which interdental papilla forms the main part. Now, usually we remove the denture base material from between the teeth so as to expose as much as tooth possible and also to hide as much as of the denture base. And a correctly formed interdental papilla accomplishes four definite purposes. First one is that it creates a hygienic, self-cleansing interdental area. It should not be over accentuated with any depressions, grooves, wrinkles, folds or any other shape which would defeat the smooth cleansing action of the lips or cheek. So to be self-cleansing, this interdental papilla must be convex in all directions. The second one is that it's a complementary factor in age interpretation. So the papilla becomes progressively shorter and wider in the older dentogenic interpretation, as you can see in this picture. So the first one is of a normal youthful condor of interdental papilla. The second one, the shortening can be noticed as the age progresses, and then the papilla becomes progressively shorter and wider in an older dentogenic interpretation. Then the third one, it determines the outline form of a teeth. So we can make changes to this outline form according to the aesthetic requirements, such as the age interpretation, the personality identification, etc. The proper shape of the papilla can change a square tooth into a tapering or an ovoid tooth. So we can make changes to this outline. And then it brings a degree of color reflection to the interdental area, which creates illusion of a natural dental composition. So these are the main points of interdental papilla. Coming to the lingual cutaway. So lingual cutaway is actually a groove in the lingual interdental surface which begins at the contact point of the teeth when the teeth are together, or if they are having diastema, it begins at the tip of the interdental papilla. It widens and deepens according to the natural divergence of the lingual proximal tooth surfaces, and it fades away into the palatal surface of the denture. The reason for the lingual cutaway is that food, when it is incised, will sweep through this polished channel, and so it will keep the area clean. It also prevents an unnatural exposure of plastic behind the tip of the papillae. So this is the purpose of lingual cutaway. Finally, the last one, that is a labial and buccal denture base condor. So the denture base condor beyond the matrix, that is the visible denture base, it should provide a self-cleansing surface, and so it should not be over accentuated with depression, grooves, wrinkles, folds or any other shape, because we have already discussed this will prevent the smooth cleansing action of the cheeks or lips. And characterization for aesthetics of the denture base beyond the visible portion is not needed, because it's just an impractical waste of time and effort. And a thickened anterior border of the wax occlusal rim distends the lip unnaturally outward, as you can see in this picture, and also it distends the lip upward, and so it should be prevented. Thus, we have completed discussing all of the dynesthetic considerations, and next we shall be discussing errors in aesthetics, which we shall continue in our next session. Thank you all for watching this session. I request every one of you to please do like and share my videos, and if you have any queries or feedbacks, you can either comment below this video or you can mail me to this mail ID. And if you are new to this channel Prostho Hub, please do subscribe to it and support me. So it's a bye from Prostho Hub until our next session. Thank you.